So I'm Sarah Kerch, and I'm the Program Director for the Wisconsin Comprehensive Cancer Control Program. We staff and facilitate the Wisconsin Cancer Council, our state's coalition, dedicated to reducing the burden of cancer in Wisconsin. So the first portion of today's webinar all of the webinar today is going to be on cancer survivorship. The first portion of the webinar will be a summary of cancer survivorship, really highlighting growing needs at the national level and at the state level, and going over some national recommendations and approaches that are being led at the national level that we hope to explore a little bit more at the Wisconsin level. And then for the second portion, we're going to turn it over to Tina Papp, our program specialist with the Wisconsin Cancer Program, to discuss the 2019 summit. And spoiler alert, it's going to be on survivorship. And so think about when I'm presenting a little bit about national information, think about some topics that might be of use and help to you or interesting when we discuss then later about the 2019 summit and generate some ideas. So I wanted to just kick this off. Dr. Melinda Stolle is our chair of the Wisconsin Cancer Council. In her day job, she's the Associate Director for Prevention and Control at the Cancer Center at the Medical College of Wisconsin. And she and I have the opportunity to check in on a monthly basis, and she shared with me an interesting meeting that she attended at the National Cancer Institute earlier in 2019, and it was about evidence-based approaches for survivorship care and where are the research gaps. And with that, Melinda shared some really great national level information that was used as a background for the meeting and the discussion. So I'm going to be sharing that background information with all of you today, and we'll look to Dr. Stolle when the results of that meeting are available later for her to come back and maybe share that, or maybe use that as an opportunity to share more at the summit later this year. But there were three articles. The first that I wanted to highlight and has really served as a great cursor and kind of global, and just as a reminder, we're getting some feedback just to mute your line. But one of the big articles was about equitably improving outcomes for cancer survivors and supporting caregivers, a blueprint for care delivery, research, and education. So that was out of Cancer, a journal for cancer clinicians. So some findings from that, 1.7 million Americans are expected to be diagnosed with cancer in 2018. So that was historical data. I'm not quite sure if that actually came to be, but about 1.7 million Americans were expected to be diagnosed in 2018. And of those Americans are living with a history of cancer. That population is growing due to population growth, aging, and advances in early detection and treatment. And when you break it down by the numbers, 20.3 million are expected to be living with a cancer history in 2026, and that'll increase by about 6 million by 2040. So quite a big increase just in 14 years is projected. And to add to that complexity are changing demographics. So 73% of cancer survivors will be 65 years or older by 2040, which is an increase in 2016, where the number right now is 62%. So that's about an 11% increase just in a few decades. And adding to that as well is the changes in our demographics by race and ethnicity as a country. So 125 million cancer survivors will be non-Hispanic white individuals, and that'll increase to 157 million people by 2030. However, the non-Hispanic white cancer survivorship will stay relatively flat. So that's just saying that as our socio-demographic changes in the country, so will our cancer survivorship numbers as well in that group. However, the mortality gap continues to be high for racial and ethnic minorities younger than 65 years. And what this paper hypothesizes is that this is a group of individuals that do not have access to Medicare, and as a result, they face higher mortality gaps than their non-Hispanic white counterparts. So the implications for that. So older cancer survivors have several comorbidities, which make delivery of active and post-treatment cancer care more challenging. The cancer care team is dealing with more obstacles as they treat cancer because they're facing diabetes or heart disease, et cetera. Additionally, cancer survivorship and post-treatment care is complex as they deal with cancer on top of those comorbidities as well. Additionally, racial and ethnic minority cancer survivors face a multitude of barriers, including informational, structural, and financial barriers, preventing them from receiving quality cancer care and post-treatment care. And it's important, and this paper really highlighted that survivorship care research and practices really need to make sure that they consider these issues. So in the article's title is even sharing, the blueprint. So what do we do with this information as a cancer care workforce? And the paper highlighted 3 priority areas. The first being implementing routine assessment of survivors' needs and functioning and caregiver needs.
Problem is it will not be.
And including that is really establishing a process for communication between clinicians, survivors, and caregivers. Comprehensively and routinely assessing symptoms and limitations to refer to multidisciplinary teams. And you'll see multidisciplinary teams come up at several points during this blueprint recommendation, and that's going to be especially important given workforce shortages between oncology workforce shortages, not able to keep up with the growing demand of the baby boomer generation being diagnosed at higher rates of cancer and aging. And then of course, there's the national nursing shortage that does not exclude Wisconsin from that group. Wisconsin's facing that as well. And additionally, there is PROs, or patient-reported outcomes, that are becoming more and more popular and more widely used to aid in these assessments. And that comes into play, those PROs, in the second priority area that was recommended, and that's facilitating personalized, tailored information and referrals from diagnosis onward for both survivors and caregivers. I think that's an important note, and caregivers, not just survivors. And shifting these services from point of care to point of need wherever possible. And it's really using that patient-reported outcomes mechanism that's reported in this first recommendation and using that PRO information to facilitate personalized multidisciplinary referrals. So thinking about a really large care team, not just oncologists or patient navigators. It's thinking about primary care or complementary care, and it's thinking about it from a really large perspective. And then it's disseminating and supporting the implementation of new care methods and interventions. The first, thinking about switching from the fee-for-service models to a value-based care model and activities to support this model. Clear and digitized clinical care guidelines accompanied with regulatory and policy reforms to support new care methods and interventions. And so really thinking about electronic medical records as a tool and hopefully not a burden to think about how we can support clinical care guidelines as well. And certainly thinking about the policy aspects about making this institutionalized and across the board, not just by system to system. Health system to health system, and then work with payers to address under and unreimbursed care. And so I think there are a lot of survivorship and caregiver support services that are not being reimbursed at this moment or being under reimbursed. And so thinking about opportunities to work with payers and obviously policymakers as well to identify ways that we can make sure that care is being reimbursed and then ultimately being received. There were 2 other papers that were really thought as background for this meeting as well that I wanted to highlight as well. Both came from the Journal of the National Cancer Institute and were published in November of 2018. And just to take a step back, the article that was previously highlighted by myself was published earlier in 2019. So these are 3 really relevant and newer articles when it comes to survivorship care. So the survivorship science of the National Institutes of Health, lessons learned from grants funded in fiscal year 2016, was really portfolio analysis in 2016 that was used for the NIH to describe how they funded survivorship projects in a 20-year period. And they really wanted to take a look in this analysis to understand the nature of the research that was being conducted through NIH funds, establish benchmarks for how they want to and should be measuring the work of their research portfolio, and then clarifying future direction. So, you know, we've spent at the NIH 20 years of funding survivorship care. How do we want this to look in the future? How has it been going, and how do we want it to move in the future? And really the findings and conclusion in that were that there are 215 grants that were funded on survivorship science, and the gaps that the NIH found in this paper, and there was a lot more to this paper, and with all of these, we'll make sure that they're included in whatever follow-up emails that we send to you, but I wanted to kind of point out the gaps that they acknowledged, and it really has similarities to the papers that I just referenced with the blueprint, and that they need to expand research on the older, longer-term survivors and caregivers. And so as treatment and early detection advances, and as our population grows, this is going to be a bigger and bigger population group that we need to have more research on. We also need to have a better understanding of the social, cultural, and geographic backgrounds, or make sure that those populations are becoming more of a focus in our research portfolio as the demographic shifts, as I highlighted before. We want to make sure that we have research and evidence-based practices to help with that as that trajectory is planned out as laid out in the blueprint in the previous article. And then they acknowledged that there were some neglected topics when it comes to research. And Tina will get into this a little bit, but sexual dysfunction and financial toxicity were two neglected topics that were mentioned by the NIH, and happen to also be topics that have come up in just some preliminary conversations for the summit. And then the third neglected topic was also competing comorbid conditions, which was highlighted as the blueprint as a really growing need and area that needs to have more focus. And then in the long-term survivorship care after cancer treatment, a summary of 2017 National Cancer Policy Forum Workshop. This article really highlighted an event that took place back in 2017 in July over 2 days that convened diverse stakeholders and reviewed progress and challenges since the Institute of Medicine's report on adult cancer survivors, which was published in 2006. And the themes that were generated from that is that they feel like they felt that there was progress made since 2006, but many recommendations still really need to be fully implemented. And some of the progress that they felt was successful, or progress that has been made, are one in particular that I know a lot of Cancer Council members are very familiar with, and that's the Commission on Cancer Survivorship requirement for survivorship care planning. And then there is the Center for Medicare and Medicaid Services Innovations Oncology Care Model, which requires psychosocial services and survivorship care plans for beneficiaries, which I believe some Wisconsin folks are familiar with as well. And this paper also made some recommendations here in the box to the right. That's actually just taken from this specific article, but I wanted to just kind of highlight them in a fewer words. But this task force really, in the workshop, participants highlighted that there needs to be more education when it comes to the workforce on survivorship. And we want to focus more on all aspects of cancer survivors, improve data collection on the diverse survivor population. We want to make sure that we integrate the evidence-based psychosocial services into the medical standard of care. We want to they also pointed out the need to develop and implement quality measures for survivorship care plans, assess and conduct assessments and interventions at diagnosis through follow-up for tailored care. Also increasing access to primary prevention, early detection, and chemoprevention for prevention of secondary cancers, which is obviously very important. Improve precision in oncology, so having the right treatment to the right person at the right time. I felt like I wanted to make sure I include that statement because it made it seem so easy. However, I recognize that precision in oncology care and having that statement is all of these recommendations, while they're straightforward, which is helpful, there's just so much complexity to it all. The 9th recommendation was the delivery of high quality survivorship care. And the 10th is promoting accessibility and affordability of care for all survivors. So while they're, straightforward and I was able to, summarize them to all fit on one slide, we all know that there's a great deal of more activities that is necessary for this work to actually occur. So I wanted to quickly then, taking it at the national level and highlighting some, survivorship needs from the blueprint, getting into recommendations from the other 2 articles, and kind of seeing what at the National Cancer Institute's been funded and research avenues that have been previously explored. I wanted to dig a little bit more into cancer survivorship in Wisconsin. The first place I went to was our friends over at the Wisconsin Cancer Reporting System, and referring to the September 2016 report on Wisconsin cancer survival. And so here is an infographic that is actually lifted from that report, and it really, I felt like, was a good tool to use and discuss today for this presentation on where we're at in Wisconsin cancer survivorship. And so 64% of people with cancer in Wisconsin survive 5 years after being diagnosed. So that's well over the majority, which really indicates that there is a really large population of Wisconsin cancer survivors that need our attention and specialized care based on their cancer history. The highest survival rates are for go down: prostate cancer, thyroid cancer, testicular cancer, breast cancer, and melanoma. So those are the 5 types of cancer with the highest survival rates, with the corresponding percentages of people diagnosed with that cancer that survive. And here, at no surprise, early detection and cancer screening are pretty critical for the, identifying localized cancer at the local or at the early stage, which then proves to have the highest survivor rates. 88% of cancers that are diagnosed at the local stage, have the greatest chance of survival. So 88% of cancer patients. And then it decreases, obviously. 3/5 of cancer patients diagnosed at the regional stage of the disease survive 5 years, and it goes down to 26% when at the distant stage. So that really highlights the importance of early detection, and it also really highlights that early detection is increasing this cancer survivorship, which is really great, but it brings a kind of a new area of exploration in cancer survivorship, and making sure that folks that survive cancer are still living really quality of life at a high level. And then here I wanted to just highlight that African Americans have a lower cancer survival rate than their white counterparts. And I think that is likely because of the structural, informational, all of those barriers that were highlighted in the blueprint. And so it's important that we think about overcoming those barriers, and also think about the unique needs of African Americans and minority populations and their survivor needs, because there will be more as projected of those populations. And so we need to think and have research, as the NIH is pointing out, that is grounded in those populations and includes those backgrounds. And then again, at the Wisconsin level, it's similar to the national trends, where the oldest age group of cancer survivors is the largest and fastest growing group. And so with that comes those additional comorbidities, and thinking about, diabetes on top of cancer survival, and heart disease, and other chronic diseases that older individuals are more susceptible to. So I wanted to just highlight what's been done in Wisconsin to understand survivor needs. And so in 2010, 2012, and 2014, we bought into the Behavioral Risk Factor Surveillance System, or what I often refer to as BRFIS, and I know many of you all do as well. And we bought into the survivorship module, which examines the receipt of healthcare services among cancer survivors, their health insurance coverage, their enrollment in clinical trials, and pain management. And I think it's important to note here that this survey is really helpful and instrumental, not just in our survivorship area of the cancer care continuum, but we use it as a tool to measure progress in prevention, screening as well. And so it was a great opportunity to add in the survivorship module. One of the limitations, though, is that we're not able to tailor the questions, and what the survey is pretty prescriptive in that. But we did, over the three iterations in 2010 to 2012 and 2014, have over nearly 17,000 responses over the 3 rounds of data collection. And what we found was that 28.3% of the responses or respondents did not receive instructions from health professionals regarding where to receive routine cancer checkups. 35.9% received a written summary of all cancer treatments. So the story there is that, about 65% of people did not receive a written summary of their cancer treatments. Quite a few of the majority had insurance for cancer treatment, but 7.2% of those people were denied insurance coverage due to their cancer diagnosis. And so I think the note there is that was historically pre-Affordable Care Act protections of pre-existing conditions. I found the word, thankfully. And then 7.07% of the respondents participated in clinical trials. And approximately 7% reported current pain from cancer or their treatment. And 80.5% had their pain under control. So what's been done to address the needs that were just collected and highlighted from the Behavioral Risk Factor Surveillance Survey? I wanted to highlight that this is work that, this is not inclusive of all the work of the Wisconsin Cancer Council membership. This is work that's been done from the staff that facilitates the Wisconsin Cancer Council that has been trying to work with and stimulate progress and work in local areas of the state. So this by no means is inclusive of all of the great work that you've all been doing as well. But one of the big things that we've done is through our Wisconsin Comprehensive Cancer Plans. And so throughout all of our iterations, the one that's highlighted here is the 2015-2020 version, but in the 2 previous versions of that, we've had cancer survivorship as a highlight. And I think as the research and recommendations and the growing need expands, the highlight and emphasis has grown in our plans as well. But here to the right, you can see that we've had a separate even survivorship priority 10, just on increasing awareness and knowledge of issues relevant to cancer survivors. But as you look through the pages of each of those priorities, you'll see cancer survivors and their needs in a multitude of other areas, particularly in priority 9, 11, and 12 as well, and not to mention their importance in all of the primary prevention priorities as well, and tobacco and high-risk alcohol use and healthy active lifestyle. We've also done survivorship forums, and that's bringing together regions of Wisconsin cancer survivors and health system experts in various regions to talk about cancer survivorship and how it impacts them, and to identify some solutions and best practices on how we can really address the needs that were identified during those forums. And those were held in 5 different years, 2010, 2011, 2012, 2014, and 2016. So we've taken a couple-year break, which is another reason why we thought that this summit theme on survivorship would be particularly helpful. We've also done a couple of different survivorship funding opportunities in 2012 and 2014 on patient navigation and survivorship care plans, and 2014 and 2015 transitions in care. And so that's part of our implementation grants project, and was really kind of the start of some of the series and kind of the framework and how we use and structure our implementation grants right now. And then, as I mentioned before, we did the data collection using BRFIS in 2010, 2012, and 2014. So areas of future exploration. Well, certainly the Wisconsin Comprehensive Cancer Control Plan 2020-2030 is going to be another opportunity for us to really set our own Wisconsin blueprint and how we want to take action as the Wisconsin Cancer Council and other Wisconsin cancer stakeholders on addressing cancer survivorship in this growing need, both nationally and specifically in Wisconsin. We've also had the opportunity from the Centers for Disease Control and Prevention, or CDC, as a Wisconsin Comprehensive Cancer Control Program, along with all of our peer comprehensive cancer control programs at other states that all work to convene a coalition to do this work. In our state, it's the Wisconsin Cancer Council. And we responded to this supplemental funding opportunity. And what's really outlined by CDC is data surveillance via the BRFIS survivorship module, and knowing the limitations with that BRFIS survivorship module and survey is really the reason why we decided to explore a supplemental survey with the Survey of the Health of Wisconsin, or often referred to as SHOW. And so we're working right now on creating a survey to collect information about cancer survivor needs and their caregiver needs, and what they're dealing with here in Wisconsin, and get to a little bit of a deeper, more granular level than what we're able to at the BRFIS survivorship module, to really look at these both together and get a more comprehensive picture of what's happening with Wisconsin cancer survivors and their caregivers. And then there was a focus from the CDC for us to work with Cancer Council members on patient navigation and care plans. And then do a great deal of primary care education. So educating the primary care workforce on cancer survivors that are coming back out of active treatment and are now dealing with their primary care team, and making sure the primary care team feels confident in dealing with the unique needs of cancer survivors. And then, of course, doing our due diligence and disseminating the findings and the work that we do here in Wisconsin. So we hope to find out more and have more to share with you in just a few short months. We should be finding out in about July from CDC, but we hope to have good news and greater opportunities with all of you to participate and do more work in Wisconsin. And then, without further ado, it's the 2019 Wisconsin Cancer Summit, which I think timing-wise, with the absence of the survivorship forums that we've been holding, and given the potential news that we'll have from the CDC on our project funding to do the work that I just highlighted, and all of the great summaries that just came out from our folks that are leading quite a bit of work at the National Cancer Institute. So just a great opportunity for us to bring the Wisconsin Cancer Council and stakeholders together to talk about the Wisconsin cancer survivorship issues and needs and opportunities to address those. And so we've worked with the steering committee to come up with that theme, and Tina will get into that in a little bit more. But before we get into the Wisconsin Cancer Summit, I actually have some questions for all of you, given that this is a networking webinar and I've been talking quite a bit. So in Wisconsin, what are you doing to address cancer survivorship in your work and region? What seems to be working, and what could you use assistance with? And so we're going to use our phone. So if you wanted to unmute your line to share, or of course use the chat feature, it would be great to get some discussion on this. And we had one response from Amy Tabarwick about having audio cut in and out. Is anyone else having that issue? I'd like to say, with no one else responding, that is not a global issue.
Yeah, audio's been good for me so far.
Okay, thank you. Okay, so what is anyone else in Wisconsin, Cancer Council members, what are you doing to address cancer survivorship in your work and region? I know a lot of you are dealing with the Commission on Cancer Standards and trying to wrap your head around what a big, requirement that is. What seems to be working, and what could you maybe use some assistance on? So don't fear, unmute your line or type in the chat box to share more.
My name's Megan. I'm from Marshfield Clinic. So I'm the survivorship program coordinator, and I've been meeting with any patient after their active treatment. And I kind of just go over, more of a holistic approach. It's important for to get their care plan, but I kind of get down to the nitty gritty of what they need and what their caregiver needs. But it just seems like, I don't know if anybody else has issues trying to get them to open up more, if they're getting to the point where they just want to be done with treatment and move on. But there's a lot of things that they need to know for side effects to help them out in the future.
Megan, a follow-up to that is, from what you just mentioned, you work with them kind of after they're done with active treatment. Do you do any work with them while they're still in active treatment?
I've been trying to. I just started this position in December, so I'm still trying to get a hold of the manual work of just seeing who needs to be seen. Luckily, we do have 2 navigators that help out with that, or 3 navigators. But I've been trying to meet with them, at least in the chemo clinic, while they're getting infusions. But those are probably the ones that I get the best discussion with, because they've been through a little bit more, where maybe it's just endometrial cancer that has had a hysterectomy. And there's still a lot to go over with them, but it wasn't a big deal to them because they had a surgery and now they're done. I generally don't get to meet with anybody that does not come up to oncology hematology.
Got it. Thanks for sharing, Megan. Has anyone else had problems like that, or any solutions? Is that a theme from other health systems? And feel free to just chime in by the chat as well. And Megan, I made note of that as one need and something to think about and to make sure we use and incorporate when we build out some programming for Wisconsin Cancer Council members and of course the summit. Okay. Thank you for sharing. We have one other question from Julie about her having quite a few survivorship events, but having a low turnout of participants, and asking about how she can get better buy-in and spread the word to get more participants in things like support groups, education events, etc. Has anyone else had problems, with survivorship, survivor events having low turnout?
This is Rachel from Mayo Clinic. We had some issues we had identified patients for survivorship, but the patients were either no showing the appointment or just canceling it. We had determined that we would send out survivorship letters to patients before their appointment, and we would also make the survivorship appointment on the same day as maybe a 1 month or a 3 month follow-up with their medical oncologist or with the provider that treated their cancer. So that helped us to actually increase the rate of those survivorship visits, and now we're trying to roll that out for urology department and endocrinology as well.
Thank you for sharing. And just to jump back to Julie, one thing that the Wisconsin Cancer Council can help certainly is we have a partner events page on our website to promote some of the great work that's happening with local Wisconsin Cancer Council members. So if you have events like that, feel free to share with us. We don't necessarily have the survivor audience, but there might be organizations in your area that are also Cancer Council members that could be, helpful in spreading the word. So think of that. And then also our networking directory, you can actually pull out organizations that might be in your area that could help promote as well. And I apologize if you've already done that, but I'd be happy to think about that through with you as well.
For events, Megan from Marshfield Clinic again, we did a survey, and we just had an event last week where we had 60 people show up, 90 people registered, and we did a topic of eat, sleep, move, which from the survey from our prior one, that's what people were interested in. And then we have a Survivors Day event coming up, and just from getting people from the first event, they're kind of trickling in. And we've been trying to give away good goodies. I mean, it's not about the stuff, but people seem to come and want nice things. It gets them out. But even just the content itself of information, it was a lot of good feedback. And we had someone come in for aromatherapy, working out, and then how to eat healthier lifestyle with eating.
Great, thank you for sharing, Megan.
And we use Eventbrite to get our events out there.
Great. Sherry on the chat mentioned that their focus has been on workflow for providing survivorship care plans and ways to integrate care plans into the electronic health record. They've had a number of classes that are offered to survivors, but it takes quite a bit of work and resources turnout is not huge. And so asking, like, do they even want classes? What format would be the best way for them to receive survivorship information? And they plan to have survey with primary care providers about their experience with care plans and if they find them valuable. Are they reading them? Are they using them? Has anyone done such a survey of primary care providers and their usefulness or their use of care plans and whether or not the care plans are useful to primary care providers? Has anyone done such a survey? Well, perhaps that could be something that we could explore and talk about with any supplemental work that we do as a Wisconsin Cancer Council staff to generate some activities and help with members. And Kirsten at Gilda's Club said that there's currently a study at the University of Wisconsin that's exploring just this topic. So Kirsten, we'll have to get in touch with you to make sure that we spread that information in the follow-up so people are able to, and connect with Amy Tabarwick on that, the UW Cancer Survivorship expert. So thank you, Kirsten, for sharing that. And Amy, thank you for volunteering without volunteering. Thank you, Regina, for putting that link out as well on that. So I think that there will be a lot of opportunity to kind of continue this conversation as we talk a little bit more tangibly about how we can, do more as a Wisconsin Cancer Council to, address the needs and make sure that we're giving you all the tools that could be useful and convening all of you to share best practices, et cetera. And I think one great opportunity for that is through our 2019 Cancer Summit. And so just a polite reminder to everyone to mute your lines if you are not muted. There was getting a little bit of feedback, so thank you. So again, this is Tina Papp, our program specialist and our main lead for the 2019 Wisconsin Cancer Summit, and she's going to help us go through some questions and some updates about where we're at in the planning for that. So thanks, Tina.
No problem. Thank you, Sarah. So as mentioned, today's topic is going to be about the 2019 Wisconsin Cancer Summit. This year, the summit will be a 2-day event that will entail an afternoon meeting, discussion about the WICC plan, and a pre-summit reception on Wednesday. And then the following day will be the Wisconsin Cancer Summit itself. So please mark your calendars for Wednesday, October 16th and Thursday, October 17th at the Wilderness Resort in Wisconsin Dells. We do hope to see you all there, and I'm sure you'll be receiving save the dates soon, as well as a lot of newsletter updates on the summit itself. So now I wanted to talk to you all about the details of the summit and what we would like to achieve from the day. We as a staff discussed 3 important objectives that we wanted to base the day off of. We want everyone who attends the summit to hear from survivors and caregivers themselves to understand their experiences. What we hear from them will mold how we continue to provide care in the future. We want the summit to be an opportunity for everyone to develop and identify solutions based on a survivor experience. And we also, from there, want to apply these solutions into practice. This would be a great opportunity for everyone to really listen and learn from survivors and caregivers. With all that being said, we were able to develop a tagline for the summit, Lessons from the Front Lines, and we felt this was fitting because the people we will be hearing from are those who are experiencing it firsthand: survivors, caregivers, physicians, healthcare professionals, and many others. And finally, a brief write-up of what to expect at the 2019 Wisconsin Cancer Summit. Join us for the 2019 Wisconsin Cancer Summit, where we'll explore the theme of cancer survivorship. What do cancer survivors and caregivers want us to know? What does research tell us about survivor and caregiver well-being? How can we apply these lessons to improve outcomes and experiences for survivors, caregivers, and their families? When we position survivors and their stories at the center of our work, new ways of approaching cancer control and prevention can emerge. And some updates. Now that we've covered the summit details, I want to provide you all with the updates that we have so far. We have extended an invite to Governor Evers. We have not yet heard back, but we do hope to in the next few weeks. For those of you who attended last year's summit, we had an afternoon breakout session that featured cancer survivors and caregivers as well. And Joe Lee, who was a caregiver for his wife who passed away from cancer, spoke about his experience as a caregiver and what him and his wife had gone through during treatment and care. We also plan to have Governor Evers and Joe Lee speak during the morning session to give a brief introduction to the day and to set the tone and feel for the rest of the summit. We're happy to announce that our afternoon discussion or main presentation for the day will be a documentary produced by Dr. Alice Yan from UW-Milwaukee Zilber School of Public Health. The documentary Sisters We Thrive, Stories We Tell is a compelling film that includes voices from survivors, researchers, healthcare professionals on issues related to racial ethnic disparities on breast cancer outcomes among young African-American breast cancer survivors in Southeast Wisconsin. The documentary is about 20 minutes long. Concluding the documentary, we will be having a feature conversation with Dr. Yan and some of the women from the documentary itself. It should be a very inspirational and educational session for everyone. So with all those updates, I wanted to share with you a tentative agenda. Sorry, it looks like it could be a little blurry on the screen, but hopefully still readable. Piggybacking off of our speaker update, I wanted to share and ask a few questions about breakout sessions and different things that you guys would like to see at the summit in the next few slides. So as you can see, we have Governor Evers and Jolie speaking in the morning. However, we do still have a few spots, including breakout sessions. From this discussion, we hope to have an idea for at least half of these breakout sessions. So please feel free to chime in during the discussion periods as well as the poll that we'll be having. And we also want to provide you all with the opportunity for suggestions of people to speak during the day and possibly for the breakout sessions. So please don't be afraid to share. So what can we do to help survivorship care? My first question is, based on the research that Sarah shared, there's a growing need for survivorship care that we need to fulfill. Topics like caregiver support, palliative care, sexual health, and so much more. Knowing all this, we want to make sure the summit is an opportunity for us to hear from the survivors and caregivers, identify solutions to the problems that they face, and hopefully develop best practices that we can set forth in the workplace. Based on the following discussion, we ask for your help to narrow down some of the most important topics we face in survivorship care today. So I want to ask this poll question, knowing all this, and this is an opportunity for us to hear from survivors and caregivers to identify the solutions to the problems they face. Based on the following discussion, I would like all of you to answer the poll question and choose the top 3 that you would like to see at the summit. The poll should pop up now, and I'll leave it open for a little bit for all of you to answer, but as I stated, if you could choose the top 3 that you would like to see at the summit, we will have further discussion on them and talk more about any topics that we could be missing as well. And please let us know if you're having any issues with the poll or you can't see the poll or anything of that sort. Looks like there are 11 people who have answered so far.
It looks like folks might be having a problem with only selecting one, so I guess we really made the question hard to answer, but it helps us really zero in on some potential topics. So I guess choose the one that you have at the top of your mind right now, and we'll have a discussion about the other 2 that you would like to see as well.
I believe the poll only allows us to select one. At least I was only allowed to select one.
Thank you. Thank you for letting us know.
It does appear that there's somewhat of a, I think we could probably end polling, and if folks wanted to, maybe chime in via the chat about, some of the others. There are 5 options. We asked you to pick 3, and we've already done some, preliminary investigation, and we think that these will likely be some topics that we move forward on. But we can get into a little bit more detail and conversation in the next slide about where we're at.
Okay, so it looks like for the most popular topic that we have right now is caregiver support. And then from there, financial toxicity is something that everyone would like to discuss as well. Then it looks like we actually have a tie for the third topic, which includes the last 3: survivorship care plans, patient navigation, and sexual health. So we will discuss more about those in the upcoming slides. Thank you all for participating in the poll. Okay, so does anyone have any thoughts on the topics that were just suggested? Looks like we have a chat comment in here from Kirsten. She said, I have had many people talk about the challenges of returning to life following treatment, the emotional toll of treatment. If anyone would like to type in their other 2 choices from that poll, that would be great as well. I can.
So Kirsten, just to get to a little bit more about returning to life, I would imagine that includes, life meaning returning and being an active parent, going back to work, anything else that would be included in kind of life to think about how we could zero in, or returning to life is such a big topic, and I think you could take a really global perspective on that, but I would imagine work being one really big aspect of that, and as well, and being part of a family.
Yeah.
Okay.
Yeah, so what we've been hearing a lot of here is just that for a lot of our members, when they're done with that initial treatment, just going, the feeling of the word I hear most frequently here of being unmoored when they're done with treatment. And some of it has to do with the survivor care plan, but really more the emotional and the lived experience of going back to work, re-engaging in home roles, because they may have delegated childcare while they were in treatment, and needing or things like paying the bills. Okay, honey, you do that while I'm sick, even though I'm the person who has been, sort of our financial manager up to this point. So the financial piece, the aspect of looking at, who am I now that I'm done with treatment, just that whole experience, life-changing experience, and what does it mean, and how am I going to embrace this now?
Mm-hmm. Definitely. We would like to look into the support services that are provided for survivors out there right now, anything on finances. And there was a lot of talk about family support after that too, because family members don't know how to deal with survivorship, and they're also scared after, a family member comes out of cancer treatment and is now, a survivor of cancer.
Right. So, Gilda's Club and Cancer Support Community, there are some really great resources that we have on financial toxicity and following treatment. I don't know if anyone has talked to Triage Cancer.
Triage Cancer?
We have, as a staff, talked with them a little bit, and, but it would be interesting to hear how you think that they could be useful, Kristen.
Yeah, they have some great workshops on work and careers and how to deal with your lived experience, you know, okay, I'm coming back to work and now everybody wants to talk about cancer and that's not why I'm here. So I think that they've just done some really great workshops and I know that they're happy to come and do things.
That's great to know. Thank you. So it looks like Regina said something on the chat as well. She said there also may be issues surrounding faith, either renewed, gained, or lost, and what that might mean to how they view the rest of their lives. Has anyone else had any discussion about this in their workplace or have talked about it? Or any recommendations on that topic specifically? Regina, did you have? Go ahead.
Sorry, this is Kirsten again. And yeah, we talk about that a lot, particularly in our cancer, our moving forward group, which is a survivors group. But it's more been discussions as opposed to resources.
Okay.
For us, at least.
Thank you for sharing.
Mm-hmm.
It looks like we also have a comment from Sherry. It said, children as caregivers with younger diagnosed patients, what about their children? I don't feel we do a good job of assessing the younger caregivers' needs. We are lucky to have chaplains that address faith with patients, but not enough resources for all patients to have discussions. Oh, so I see that that's a two-part chat there from Sherry. So it looks like she answered the comment that Regina actually had talked about with chaplains, and then also commented on children as caregivers. So we are looking at the topic of caregiver support, and it looked like that was something that a lot of you would like to discuss as well. Does anyone have any comments or recommendations on caregiver support and anything that they've done in their workplace pertaining to caregiver support? I also just wanted to add that we are still looking for speaker recommendations on any of these topics. It doesn't even have to be, you know, the 5 that I had listed on the poll. It could be topics that you have discussed at your workplace and had someone come in and really, you know, talked about a topic that was moving and had a lot of turnout. So we would be happy to have any suggestions on that part as well. So if you would like to share about any recommendations of speakers that have come to your workplace or people that you have worked with that have talked about topics on survivorship, that would be great.
If anyone could use this, we mentioned the 5 topics that come to mind, and I think given the spread of how everyone selected them, I think all 5 of them could really actually be good ideas for breakout sessions or general session discussions. You know, if we line them up with breakout sessions, we typically have 6 breakout sessions, so that means that there could be a 6th option that's not listed. So if anyone feels really strongly, you know, I think the caregiver, the faith, those are all really good ideas that we could include there as well. But maybe does anyone disagree with any of the 5, you know, and going back at survivorship care plans, caregiver support, patient navigation, financial toxicity, and sexual health as being, you know, 5 topics to discuss? Do you think one is not maybe quite necessitating an entire breakout session? I think it means that we're probably on point with these. So with that being said, when it comes to the topics, which Tina's actually typing out right now in the chat, when it comes to survivorship care plans, are there speaker recommendations that you would have? Caregiver support, speaker recommendations, patient navigation, financial toxicity, or sexual health. Who do you want to hear from on these topics? And if you're all just a little too shy or busy typing to respond right away, you know, Tina and I will make sure that our contact information is widely available, so you can, you know, follow up by email or phone call to help us, you know, determine some speaker recommendations.
I will jump into the last question that we have on this slide, and it's a question that our new policy coordinator, Amy Johnson, wanted me to discuss, and it asked, does anyone have any policy-related topics to include for the summit as well? Looks like we have a message here from Regina, and it says, Sarah Davis, Meg Gaines at Center for Patient Partnerships could speak to a variety of issues. Thank you, Regina, for that recommendation, as well as Amy for survivorship care planning. Reimbursement for survivorship services was typed in by Sherry.
That could be a great policy topic to explore, certainly, especially given the previous research and summaries that we shared earlier in the webinar.
And then Kirsten typed in caregivers, families, Carissa Hodgson's at Gilda's Club. Thank you, Kirsten.
Okay, and then there was another recommendation, Dr. Yasmin from Marshfield Clinic about, that's done a lot of speaking about sexual health. Thank you for that recommendation.
And please feel free to email anyone on the staff with any recommendations, ideas, thoughts you have for the summit, because we would be happy to hear them, or talk to you more about, you know, anything that you've done at your workplace or people that you have brought in to speak during any, you know, events or anything that you've had go on at your workplace that have been successful as well.
Great. So again, thank you so much for taking the time to talk with us and share a little bit about your work on survivorship. I think that this is an area in kind of the evolution and the revitalization that we've taken as the Wisconsin Cancer Council that you all are so familiar with. That's kind of taken an unfortunate backseat, and we're ready to bring it back with the 2019 summit and some of the opportunities that CDC will be providing us the opportunity to do and convene with all of you. So thanks for just being on this precursor webinar. We will make sure the recording, slides, and links are all available to you after the call. And certainly our contact information if you have any other recommendations for the summit. We're hoping to close out this agenda and get it near final in the next few weeks. And then I wanted to make a quick announcement. So our monthly webinar series is typically been on the second Thursday of every month, but in June, we made the strategic decision to not hold a webinar because we're asking all of you instead of joining the webinar to participate in the June 20th Wisconsin Comprehensive Cancer Control Plan input meeting. So as many of you hopefully know, we're working to create and revise our Wisconsin Cancer Plan to be, for the 2020 and 2030 timeline. And so we need your input to make sure that it's really reflective of the needs and, of Wisconsinites, and you can all see yourselves as you work in cancer control and opportunities for you to take action. So that meeting will be on June 20th, all day in the Wisconsin Dells. You can learn more online and register to attend. It's wicancer.org/guide-the-future. So I think it's one of the first slides that you'll see on our homepage as you go on our website. So don't plan to attend the June webinar, but do please sign up to attend June 20th plan input meeting. And so with that being said, our upcoming webinar will be on July 11th, and it'll feature our 2018-2019 implementation grantees and the work that they've done. That specific implementation grantee cohort has been focusing on quality improvement projects in cancer screening. All but one, it's 5 federally qualified health centers doing various work to identify patient populations that have not been screened for various cancer types and opportunities to improve that work and improve their screening rates, and then one health system as well. So we look forward to sharing the work and the lessons that they've had in July. So please plan on joining if you'd like to learn more about opportunities to improve screening rates and just have a general interest in the area. And certainly if you have a topic that you'd like to learn more about or something you feel passionate about and you'd like to share with others, please let us know. We know that there's a lot of great work happening among Wisconsin Cancer Council members, and this would be a great way for us to share that work and maybe even share some questions that you might have that you'd like to get some answers from the Wisconsin Cancer Council membership. So that actually ends the presentation for today in the webinar. Thank you for the constant conversation in the chat box as well. We really appreciate all of the impact that you've had today. We look forward to sharing more with you at the 2019 Summit and hopefully more beforehand. So thank you so much, and we will talk with you soon and hopefully see all of you on June 20th in Wisconsin Dells.